Good afternoon, everybody. My name is Gillian Robinson. I'm Director of ARK, and it's my duty just to welcome you all to this ARK seminar today. ARK is an organisation that was set up in 2000 to open up access to social and political information in Northern Ireland, and it's joined between the University of Ulster and Queen's University Belfast. The seminar series has been running for a good number of years now and really aims to bring together in one place practitioners, policymakers, academics and others who are interested in particular topics to discuss some research findings that have emerged either through ARK's own research programme or other research that's been going on in Northern Ireland, or sometimes the UK or Ireland, where international comparisons are relevant to our social policy debate. So we're delighted to have you all here today, and I know there's a good range of people with a lot of different expertise. For those of you interested in this topic, you'll know it's coincidental but very nice that our seminar is happening today, when yesterday there were other research findings very much in the media on the whole topic of social care and provision. So our findings will feed into that general debate, and then the review is due out next week apparently. So it's all very timely, and hopefully together all the different pieces of work can help contribute to moving this policy area forward. Basic points first. Can you put your phones on silent or off, please? The format for today is that I'll introduce Anne-Marie, and then she'll speak for about half an hour, and then you'll have an opportunity either to ask her questions or point of clarification, or to make your own contributions to the discussion. And that'll go on to about 1 o'clock, and then we have a light lunch served just in the hall outside, where you're welcome to stay and chat on and speak to any of us or Anne-Marie or amongst yourselves about the debate. So that's the format. The seminar is then on public attitudes to social care provision and the future of social care for older people in Northern Ireland. The work that ARK's been doing has been led by my colleague from the University of Ulster, Dr. Anne-Marie Gray, who's a senior lecturer in the School of, Criminology, Politics and Social Policy. Anne-Marie has been working on a range of issues, but quite a bit in recent years on older people's issues, attitudes to age and ageism, and also on the social care area. So she's very well placed to lead this seminar today. The research update that you'll see in your pack was produced by her and two colleagues, Liz Ann Dowds and Paula Devine. So thanks to them for their contributions to this research as well. And I should also note that the work that ARK has been doing over the last number of years in this area has been funded by Atlantic Philanthropies, and we're very grateful to them for their support for the work. So, as I say, Anne-Marie's very well placed to lead this seminar, a lot of expertise in the area, and I'm very much looking forward to hearing the seminar. Thanks.
Thanks, Gillian. Well, as Gillian has said, this seminar is actually happening at a very good time, because it gives people in Northern Ireland, not just us, an opportunity to contribute to this debate through participating in the Life and Times survey. And that's what the seminar today is focused on. It's public attitudes to Life and Times, and it's not just older people's attitudes, but attitudes across the adult population. I think there's a number of difficulties with social care policy in the UK, but certainly one of those is that whilst social care was introduced as a part of the welfare state at the same time as health care, it's never been treated in the same way, and it's never had the same status really as health care. And that's been reflected in terms of the policy neglect over the years, in terms of funding neglect. And I think also that has had an impact on how much understanding the general population have of social care provision. Unlike health care, many of us could go through quite a big part of our lives without ever using social care, whereas we become from a very early age accustomed to using health care. I think that the fact that social care has been developed over a much longer period of time is reflected in the fact that we didn't actually have any community care policy, no policy for care in the home or in the community until the 1990s. So social care, in a sense, has been playing catch-up with healthcare services since the 1940s. And I think, unfortunately, also because of that legacy of neglect and underfunding, And because social care was perceived as more of a residual service, whereas healthcare has always been a universal service, there has been traditionally some stigma attached to social care provision, and particularly in relation to some groups. Another important factor, just in terms of context, I think, is that across the UK, social care has developed very differently to healthcare provision, and there certainly would be more differences in social care provision across the UK than there would be in terms of NHS provision. And some of the changes that have taken place in relation to social care, for instance, the fact that since the community care policy was introduced, that people have to contribute, if they have the means, towards the cost of their residential nursing home care, has led to a perception of unfairness. That unfairness is exacerbated, I think, by the fact that people don't feel that needs are being met. So even whenever people can be paying quite a lot of money, there are problems with quality of service, with access to services, and with the variability in provision across the UK. And I think for a long time, services have been resource-led rather than needs-led. And certainly in more recent times, the comprehensive spending review and the impact of public expenditure cuts has led to that being more the case. And I think particularly in England, there is evidence to show that. Since devolution was introduced in 1998, there's been additional differences across the UK. I think the one which would be most likely to spring to people's minds would be the differences in terms of payment for long-term care provision in residential and nursing care. So the Scottish Government made the decision that all nursing care and residential care would be provided to older people free of charge. England decided to charge for that provision, as did Wales. In Northern Ireland, there was a discussion about that in the Assembly, and initially the Assembly voted to opt for free nursing and personal care. And then Michael McGimsey, when he was Minister, decided on the basis of that that there should be a review into how much that would cost, and then subsequently decided that that policy couldn't be introduced in Northern Ireland because it wouldn't be affordable or sustainable. So we do have this situation now where there are differences across the UK. That's led to a growing feeling, I think, of unfairness. People point to the Scottish system, maybe sometimes not picking up on the difficulties in that system, but thinking that, well, if they can have it, why can't we have it? There have been several attempts to deal with the issue of long-term care in particular. We could go right back to 1998 when the Labour government set up the Royal Commission on Long-Term Care. But more recently, just before the Labour government left office, they'd been looking at this issue, and in 2010 had published a white paper promoting the idea of a comprehensive national care service. And within those proposals, there was a suggestion that people who would have to go into residential care would get it free after 2 years. And I think the proposals in that document were promoting at least a kind of universality in terms of care. When the coalition government was elected, it decided not to follow through on those proposals, but instead to set up a commission to look at the funding of social care, to look at an affordable and sustainable funding system for care and support in the home and in other settings. That's the Dilnot Commission report published in July this year, which has got a lot of attention in the media. Before the Dilnot Commission had been established, the Law Commission was actually already looking at the reform of social care law. And in order for these reports to feed into each other, it was agreed that the Law Commission report should actually be done in a shorter period of time. And they were asked to publish their report in advance of the Dilnot Commission report, and they did so in May 2011. So we have a debate now which is being informed by two big reports, really. The Dilnot Commission report, which I'll come on to later, and then the Law Commission report, which is more about legal entitlement and about rights for social care. What I'm going to look at now is what we found when we asked people about their attitudes to social care provision. And as Gillian said, this was done through our Northern Ireland Life and Time survey, which is an annual survey of public opinion. And in 2010, 1,205 respondents took part in that survey. We covered a range of issues, including paying for social care and how it should be paid for, whether or not people had made some preparation for their social care provision in the future, what their preference for care was, whether it was domiciliary care, care in the home, how they felt about moving into nursing or residential care, and if they were receiving care in their home, who should actually provide that care? Would they prefer it to be relatives or friends, or would they prefer it to be professional care workers coming into their home? And we also asked about the involvement of different sectors in care provision. So we asked people about their perceptions of the private sector delivering services, the charitable or voluntary sector delivering services. So there were some other issues, but this is what I'm going to focus on for the seminar today, and you can find the responses to all of the questions asked in the survey on our website. And at a later date, we will have a fuller report as well. So first of all, this really big issue, and this has been the hot potato for long-term social care for a long time, how people think that care should be funded, and particularly this question of what they would see as being fair or unfair. So we gave people these 5 scenarios and asked them about their views on these different situations. And you'll see there that at the bottom of that table is the current system, where there's a system of means testing with a threshold over which your assets and your income can be taken into account. Now, this table has information on people's responses grouped into income levels, because we were interested to see whether how much you earned or how financially well off you were had a bearing or not on what you felt. First thing to say is that the current system is not well supported, and I think there was plenty of evidence already to suggest that. Only 1/5 of respondents overall feel that the current system is fair. The preferred option for most people was for a system whereby care was free at the point of delivery, and we'd said in the question that that would be free at the point of delivery, but having to be funded through some kind of special tax or some kind of special insurance for social care. And 76% of respondents said that was the option that they would prefer. And that actually had high levels of support across the age groups. So what we're seeing there is a strong endorsement of universalism, I think. And when we were thinking about how this could be explained, I think it's probably could be explained because people can't actually or don't differentiate between healthcare provision, which is free at the point of delivery, and social care provision, which is charged for. And I think it's very easy to understand that, because a lot of the provision which people get in nursing homes, which they are paying for, is a similar kind of provision which they see other people getting in hospitals for free. And that is a very, very difficult thing, I think, to get to grips with, and that's part of what people perceive as the unfairness as well. It's not exactly clear-cut, though. I mean, people are willing to move in this issue, because a significant minority, 40%, felt that a means-tested system would be a possibility, but with all care free for people who couldn't afford to pay. So we have 40% of respondents feeling, that was something that could perhaps be supported. If you look at those results by income level, you'll see that people on relatively high incomes were less likely to endorse the option of a special tax. They were also slightly less in favour of means testing as defined in the scenarios, and I think that's because that under the scenarios provided, they would be the people who would be footing the bill in those situations. And of course they're already probably the people who are feeling quite squeezed already, because they're having to pay sometimes the full cost of their care. Given that for a long time, governments have been saying that this is a big issue for the future and encouraging people to think about it, we wanted to see if anyone had listened to that advice and whether or not people had actually made any provision for their social care. So we've had this rhetoric saying that we should. We've had it in relation to pensions since the 1980s, and we've had it, I think, more recently over the past decade or so in relation to social care. Now, it's probably not surprising that most younger people under 25 hadn't thought about doing so. 69% said they had given it no thought. But neither had 49% of all respondents, which is really quite a big number of people who said they'd given it no thought at all. People in the 45 to 54 age group were the people who were likely to have made some provision. Even here, the figure is low. But I think these are perhaps, some of these people may be people who are seeing their parents paying for care now and who are concerned, about what the situation will be for themselves. Of those people, though, only 21% said that they had some assets, like a house, or they had some money saved, which they felt that they could use to pay for their care. So, overall, people haven't been making provision, and a lot of people haven't even been thinking about making provision. The group that has given this some thought isn't actually on the table, but this group is carers of people. Because at the same time as we were asking these questions about social care, the Life and Time survey also had a set of questions about care and caring and carers. And carers were twice as likely as young people to have thought about making some provision. And again, that may be because they see at first hand, if you like, or on the front line, what the system is like and the costs involved and some of the difficulties involved. I think from these findings, the question is it actually realistic? Should we have expected more people to have made some provision? And in many respects, I think probably no. I think if people were going to make provision for anything, it is likely to have been pensions. Given the lack of knowledge about social care, what kind of provision could people have made? None of us really know what our social care is going to cost. Very few of us know whether or not for sure that we're going to need social care, so we may be reluctant to actually put aside money, for something with so many uncertainties attached whenever there are so many other demands on people financially. And it's not been an area that the private insurance market has been keen to get into because of the uncertainty around cost. And even if it had, I'm not sure that people would have been really breaking the door down to take out insurance policies. I think there's also questions to be raised about the trust that people would have in private insurance with respect to what's happened to pensions and so on. So lots of food for thought there. We asked people about their priorities for spending. We know from the figures in Northern Ireland that we have more people in residential care than is the case in the rest of the UK. So we asked if the government was going to invest more money, where ought it to invest that money? I think this is quite topical given that the review of health and social care is going to report next week and is likely to touch on this issue. Overwhelmingly, respondents were in favour of home care services. And again, that's the case across the age group. 61% of 18 to 24s said that they favoured home care provision, and as did 78% of people over 65. So over 70% support in all across the age groups. Yet we have this position where our resources are currently very, very skewed towards residential care and towards acute care. An audit office report in 2010 noted that 60% of expenditure just on older people's care goes to the residential and nursing home sector rather than domiciliary care. Now, we have heard a lot in the media about problems with residential care, about the quality of residential care provision, about neglect, and there's no doubt, I think, that has led people to be rather fearful and worried about some residential care provision. Now, of course, there is a more holistic picture here, there's a more rounded picture here. So we wanted to ask people just about their views on their own future care and what they would perhaps see as positive or negative about moving into residential care. And again, you can see the results there by age group. The greatest fear for old people is having to leave their own home. I think there's a media report early this morning which sort of portrayed the findings slightly wrongly. It said that people's greatest fear was leaving their own home and the abuse they'd experience in residential care, and that's not quite it. We asked those questions separately. So the greatest fear for people was leaving their own home, that detachment from their house. About 50% of under 45s said that they would be worried about leaving their own home, and a third of over 65s are worried about the ill treatment in care homes. Now, the reasons for that, there's been a lot of media attention in the past couple of years about neglect or even abuse in older people's homes and in hospitals. The Quality Care Commission's report recently in England in hospitals, the Equality and Human Rights Commission in England is going to publish research tomorrow, which apparently is very depressing about the treatment of older people in residential care. It's inevitable perhaps therefore that people will have anxieties, and I think we have to bear that in mind whenever we're considering these results. And I think we also need to note that a proportion of older people could also see a positive to moving into residential care. A third said it would be reassuring to have someone there if they needed help. And a quarter said it would be nice to have company and never to be lonely. And I think, having weighed this up, we know much more about the negative things about residential and nursing care than we know about the positive things. I think there's a real gap in the research here about what it's like to go into a residential home, what the pathway to, in terms of that decision-making process is like for older people, and what do we know about older people reflecting back on that decision and on their time in residential care. So we really need to hear from older people themselves about that, and what maybe could make it, what makes it a positive experience sometimes as well as a negative experience. The other thing I just wanted to say at this point is that the thing we always hear whenever there's a discussion about paying for long-term care, and particularly people having to sell their homes to pay for long-term care, is that older people really desperately want to leave something to their families. And I have to say that we didn't find that this concern was quite as primary as we probably expected. And it's, if you look at the table there, it's the younger age group, maybe the group that we're likely to inherit, that are most concerned about it, not the older people themselves. I mean, I think in some ways that's maybe a good thing, actually. If people do need support, what kind of support would they like, and who would they like to be providing that support? Now, earlier in the year, I think when the survey was launched, we launched a survey with a research update and a seminar on carers and caring, and some of those findings definitely suggested that carers are under pressure in their caring role. I think what we found whenever we asked people about what help was that opinion was divided, really, about whether it was preferable to receive care from family and friends or from care assistants coming into the home. For over 65s, 40% of that group said that they would prefer care assistants coming into their homes. 49% their own children or other families and friends. Now, in another question we asked people about if they thought that their family and friends would want to care for them, if they needed care, and in that case 91% of people said that they did think that their family and friends would want to care for them. So it doesn't seem that people are thinking, oh, it's better to have care assistance because our family won't do it. They may be thinking about that's not a burden that they want to put on families, to use that word in inverted commas, or that some people may prefer professional care and may not want to rely on family to provide care. In Northern Ireland, of course, we have a substantive number of services are provided through the private sector, particularly in the residential sector. In terms of home care, there is not as much private provision probably as there is across the rest of the UK. We asked people just a basic question about whether they felt that private companies were well placed or not and should be providing these social care services to people. 37% of respondents said no, that they thought they shouldn't. 31% supported the idea of the private sector providing services, but I think that probably the really telling figure here is the 31% who neither supported or opposed, and I think that's indicative probably of people's lack of knowledge about who provides care, maybe even to themselves sometimes. Do people actually know what sector is providing their services in terms of the wider population? How much do people know about this issue? For charities, there was more support. 72% of respondents supported charitable organisations providing care, and 15% again neither opposed or supported. I suppose one thing to say here was that we didn't include, when we asked people, we give them examples of charitable organisations, and we didn't include churches. And maybe if we had said something like including churches, maybe more people would have said they supported charitable provision as well. These findings, though, are not particularly out of keeping with findings in England and Scotland when people are asked about social care provision, where you find similar numbers of respondents saying that they're opposed to private sector provision. Now, despite the fact that we've got devolution, 81% of respondents expressed support for the system of social care being the same across the UK. You know, why is that? Is this a we want to be like Scotland point, and if it's the same, that's the way we all want to go? Or is it, if it's left to parliaments in different regions of the UK, are we really likely to get less? Or is it likely to take a long time? You know, are we likely to go towards the lowest common denominator in social care provision? I think we don't really know. We don't know people's reasons for saying that, but that's certainly very, very strong support for the same kind of provision across the UK. And linked to that, I think, is a strong support for a universal model of social care provision in terms of being able to access it free at the point of use, and for reducing the variation across the UK and within regions. So, in the last 5 minutes or so, what do these findings suggest in terms of policy, and where are we at with policy, and where ought we to be maybe? I think there's definitely agreement that the current system is sustainable. It's not meeting need, it's increasingly not meeting need, as we do have a growing older population. We do have local authorities in England and trusts in Northern Ireland with less money to provide services. We have the Still Not Commission report, which is advocating really fundamental changes to the social care system for England. And what they're saying is that they're in favour of a capped cost model of social care provision. And they've suggested a figure of £35,000, so that once somebody has paid care up to that level, the state will then pick up the rest of the cost. They're also advocating raising the threshold. The current threshold is £23,500, I think, and they have suggested raising that to £100,000, which is a substantial increase. That's probably the part of their report which has got the most attention. They've also, though, said that they feel that government should really focus on enhancing the preventative aspect of social care. So to do work which prevents more people from needing care, to have services which prevent people from having to go into more costly residential and nursing care. And I think that can be linked to general health service and policy, linked to better public health, better population health. I was quite interested in what they said about people's knowledge of social care. I think in England particularly, but also in Scotland, governments have been doing a lot of work on public engagement. So the Labour government, whenever it was looking at its social care proposal, started the big care debate. And there was a public attitude survey of people in England and Wales, and what they thought should be attendance allowance, the something could happen to make attendance allowance more linked to disability benefits, more linked to the social care system and so on. I think that point is actually quite important, because that is probably why the Dillnot Commission report will have influence beyond England. So although each of the devolved regions have responsibility for social policy, there is for the most part parity in relation to social security. So if the social care recommendations being proposed by Dillnot are accepted in their complete form almost, and there are changes to the social security system, then I think it would be really difficult for the devolved governments not to follow through on those changes, because that would mean then breaking parity in relation to social security with attendance allowance, for example. The Law Commission report's also interesting, because they talk about putting individual well-being at the heart of decision-making around social care. And they have called for a single clear statute on social care and a code of practice, and that those things would bring more clarity about people's legal rights. Now, just in the past 6 months, there have been several challenges in England to local authorities on the basis of people feeling that they're not getting social care services they're entitled to. And I think the report of the Law Commission is an attempt to bring some transparency and some clarity through legal means to that. They also talk about having regulations governing when local authorities must provide care. And again, that would introduce a new statutory responsibility, I suppose. Just to return to the Dillnot Commission for a second, we see in our findings this big support for a universal model of social care funded from a special tax or a special social insurance. The public opinion work in Britain found similar attitudes there. The Dillnot Commission say that they considered that possibility because it's a system that's used fairly widely, elsewhere across Europe and across developed countries. But they rejected it on cost grounds. They said that it would cost more money and that in the future it may be unsustainable. But it's certainly popular. And we obviously don't know whether people would follow through on what they say would be a commitment to pay more in the way of tax or to pay a special insurance. But we probably need to do more work, more qualitative work, to find out actually what lies behind people's opinions, what lies behind their thinking on this issue. And maybe we know from public attitude surveys across the years that people have a very, very strong attachment to the universality of the National Health Service. Despite the problems with it, despite the negative things that people sometimes do raise, there is never any desire to depart from that universal principle. So I think if people are saying they want the same thing for social care, then it's something that at least we need to listen to. There's several issues that the Dillnot Commission doesn't consider comprehensively. They don't really consider issues of quality and how we improve quality in social care provision. And I think linked to that there are these other 2 points about choice and independence for users and carers. Now, in Northern Ireland, in policy terms, we are certainly behind in terms of this whole debate about the personalisation of care. We know that the take-up for direct payments is lower than is the average across the UK, and we haven't really moved on this policy issue, but some of the research suggests that that's linked to quality. That if people have more of a say in their services, if there's greater determination to the person, that will raise the quality. But linked to the quality issue also is the training and sustainability of our social care workforce. It is a workforce where there's quite a lot of recycling. It's a low-paid workforce. In many respects, it's a low-status workforce, yet this is a workforce which is delivering highly personalised care to the most vulnerable people. And I think if we're really seriously talking about quality, then we need to think about the training, the professional development of that workforce, not just the regulation of it, and how it's rewarded as well, so that we can attract good people, into the caring service and keep them. So where do we go from here? Scotland and Wales are saying that they're awaiting developments in England in relation to what government's going to do about Dillnot. The coalition government has said that it's likely to put out a policy paper in the spring, setting out what it sees as the way forward. Interestingly, I think there's murmurs from Scotland that they would be keen to have a reason not to keep the current system, because in one of their public engagement documents recently, they had a preamble which said that, you know, with the demographic changes and so on, we need to think about the sustainability of the social care system for the future, and we need to consider the Dillnot recommendations very carefully. It's not just an issue for older people. It's a very, very big issue for younger people. And I think in Northern Ireland, when we do look at planning for the future of social care, we need to be doing it for the long term. You know, we can't do things in an ad hoc or an incremental basis. If it really is going to be a fundamental rethink, then we're thinking a long way ahead, and we need to involve young people in that debate. I think, as with many social policy issues, we haven't had the discussion about fundamental principles. So what should be the values that inform our social care provision? You know, what principles do we want to underpin a new policy? We haven't had a lot of public engagement on this issue. I think these findings provide a really important baseline. And I think ideally they need to be followed through with qualitative work on a number of these issues, and we need to keep monitoring people's perceptions. But I think if we're thinking about putting forward a new policy for social care, I don't know what the review is going to say next week. I don't think it's going to publish recommendations in relation to social care, because I think the Assembly will want to see what the Dillnot Commission is saying. So I think we need to create the space, you know, to talk to people about what they feel to be fair and just, and what they would like to see the Assembly here doing in relation to social care. Thank you.
To Anne-Marie for that. I mean, there's an awful lot of information in there, and it was certainly very interesting to see it all linked into developments across the UK generally. So you're very welcome to either raise some questions or further points with Anne-Marie, or indeed to contribute something from your own experience about this whole issue, which you feel is a point that needs to be brought into the debate. I forgot to say at the beginning, but we record the seminars so that they can go up on our website, so that people who aren't able to be with us can see them later on. So if you do have a question, if you just hold on for the mic so that we can record your question as well. So, anybody want to add anything or ask anything? Yes. You just hold on.
It's a point of a clarification. Thank you. Thanks. I suppose it's who as you say to a state that you only pay for a care in as residential or as nursing care. Care provided in the home is provided as free. Mm-hmm. And I suppose it is that as clarification there, because I think that's an
that's right.
Important one.
I think though that's probably something that should be noted as well, that when the Dillnot Commission is talking about this cap, it's talking mostly about residential care. Now they have said that in England people do pay towards their home care costs, and they have said there that what people pay towards care in the home will be taken into account if they then have to go into residential care. So say you've got care in the home and you've paid £10,000, then that will go towards your £35,000 cap. Now, I'm just wondering though, is there a danger that by treating the home care sector and the residential care sector differently, could there be a danger of actually creating a perverse incentive for people to go into residential care?
Well, if you look at the figures from 2008, I think there has been no actually decline in the provision of residential and nursing care, but there has been a steep decline in the number of assessments. So on the one hand, government are saying people actually should be at home for as long as possible, but the figures show the sort of opposite is actually happening. And also just a point of info as well, the department are planning to publish a discussion paper on the future direction and funding of adult social care, and it's due out in the spring of next year, and it's sort of seen as the Northern Ireland version of Dillnock. So.
Just two questions, Anne-Marie. First is whether there were any differences by gender or religion, particularly in responses, particularly in the question of attitudes to private sector provision. So that's a sort of technical question. Please provide the data if it's significant. The second one's more a policy issue, which is what is the specific case for a care tax as opposed for care funding being generated from general tax revenue? Why this particular item? Why would you have a tax for this? And if there were to be such a tax, could it be combined with any other specific payments, such as national insurance?
Yeah. On the first point, I don't think there's differences by gender and religion, but I'm frankly looking at Paula and Lisanne to see. But I certainly didn't notice any difference by gender or religion that would have been noteworthy. No.
Please don't open them.
You can go on the website and check.
The basic tables by gender and religion are
on the website. Now, the second point, I think in the past when government has talked about this in relation to healthcare, the preference from the public has been for, say, an earmark tax. So healthcare is currently funded out of direct taxation. So when they say to people, okay, if you want to spend more money on health service, should we just increase taxation? People generally say no, because we don't trust you to put the money to healthcare. So they'd say they seem to be more in favour of some kind of earmark tax. And I think in was it 2002 that Gordon Brown did put a percentage onto national insurance contributions, and he said that that 1% specifically would go to healthcare. And that happened. So people seem to have not sufficient trust in government to say that if they raise income tax by 2%, that all of that 2% would go, say, to healthcare or to social care. And I think that's why people have been talking about the idea of some kind of social insurance. Now, the other reason for it could be that because really there is quite a lot of unpredictability about cost. And if it was to come out of the general tax budget, you could just see a situation where it's just increasing all the time, and that would be difficult for government to manage. Whereas if it's a special insurance, if you like, the insurance level can be set. So if the insurance has to increase, then it can. And there could be a mandatory level, that people would have to pay. So it perhaps is a kind of insurance for governments to have it paid in that way. In countries where it's common, it tends to be countries where there's a very strong tradition of social insurance anyway. Countries like Germany, for example, where there are these special insurances. We're not particularly used to that. But I think what people are saying, not just here, but in the rest of the UK, is that if we have to pay for this in addition to what we're paying now, then we would rather see a specific payment for social care insurance, because we would feel then more protected by that. Now, Dillnock, what they're envisaging is that because there's a cap, if there was to be a cap of 35,000, that would then open the way for private sector insurers to come in and to offer people insurance up to that value. And that probably would be the case. Now, I think we know less about how the public would be likely to respond to that, given some of the concerns about private sector market and pensions.
In terms of you asked the question around the demographics and gender mix of private sector provision, is there a thought as to why people are so reluctant to look at private sectors?
I don't think we're entirely sure, because we didn't, in a survey like this, you can't ask people what actually makes them express those views. I think we can maybe only speculate that, people feel that statutory provision, it's not for profit. And there's been a lot of, rhetorical discussion about the private sector making a profit from residential care, for example, even though that we know in reality that the residential care sector is quite squeezed in terms of costs. That, I think, is not the common perception. People think about £500, £600, and it seems like an awful lot of money.
Right, Anne-Marie, could I just ask a couple of things? You said one of the things we need to do is to raise awareness and to stimulate public debate. I mean, how do you go about doing that, or do you have any suggestions for how we should go about doing that? And the second one is, you've said we need more qualitative work. Is there any qualitative work going on at the minute that we're waiting to hear from? Because it does seem to me that amongst older people themselves, we really need to understand. I mean, as you say, it's not just older people, but it would be really interesting to know more about older people's perceptions and fears and hopes and so on. So I just
to take that point last, I think there is some work going on in terms not just older people, but other social care users, people with disabilities, mental health and so on, about their experiences of social care. And I think, there's things that we will know from those studies. And there's a little bit of work in the nursing home sector. I think George may know, Brendan McCormick, I think, has done some work in the nursing home care sector. But we don't know enough. And where there tends to be work, Gillian, it's about people's experiences of particular services or people's experiences of direct payments in a particular trust and so on. We know much less about what all of us think about social care, or even about, say, the nursing home population. What's the general perception of that nursing home population on the quality of care they get, and what suggestions they would make, and so on. Now, it's a difficult area to research because, for all kinds of reasons, but because of ethical implications as well. It's not impossible, but I think we need to go there, because I think we could learn a lot by looking at the experiences of older people, their own experiences. I think we need to know more too about people's experiences of care in their own home. As far as I know, I only know of 2 studies in Northern Ireland that have looked at care, this from the perspective of care assistants from the home care workers. And both of those raise really fundamental issues about the recruitment of care workers, about their support and about their professional development. So I think there's scope there in terms of informing a workforce strategy, or the development of that strategy. In terms of stimulating the public debate, I mean, I think things like this help. Because there's been quite a lot of media interest. The media could do more. I think in Northern Ireland we're still learning really to do devolution, and we're seeing now more engagement with social policy issues in newspapers like the Belfast Telegraph and the other daily newspapers. But I think we need to see more running debates on this issue. And Judith rightly said that the government's putting out this discussion paper, but I think it would have been good to have talked to the public before that. But there's still an opportunity, in the interim to do that, and to have some kind of systematic process for engaging with the public. And maybe that starts just with simple things like information sheets about social care. So how people access social care. One of the questions I was asked in radio interviews today, and I didn't have a clue, was how much money in the past 10 years that individuals had paid for residential and nursing home care in Northern Ireland. So I had no idea. I'm sure that can be found out and it'd be interesting to know, but I had no idea. And I think there's lots of things that people would have no idea about at all, including when you find yourself in a position of needing care, or somebody in your family does, how you go about getting that care. Because we all know how what you do if you're not well. You go to your GP refers you to the hospital. I think the small pieces of research that are around are saying it's a very different experience for people who need social care.
Okay, any one last question? Because I see sandwiches outside. There, did you want to?
Marie, you had some information referring to expenditure on residential nursing home care rather than domiciliary care. I wonder how some types of care like supporting people would fit in, or is it just regarded as part of domiciliary care, or would it be a separate category?
Not always. I don't think the figures for domiciliary care, I think very often wouldn't include the supported housing. I'm not absolutely sure about that. I don't know.
If they were a receipt of a care package as part of the supported housing, it would be counted as domiciliary care.
But it's also a programme that's been cut or under financial pressure,
yes,
like
that's
domiciliary
right, definitely
care.
in the future. I mean, I suppose it was interesting Derek mentioned housing there, because on a very fundamental level, and it seems like a big thing, but yet surprisingly we haven't done that. We don't really in Northern Ireland have any proper rigorous assessment of whether our integrated health and social care system is better for people. We always assume it is, we always say it is. We have really no evidence to suggest that it is or it isn't. And maybe in some respects, I know that in Britain they have resisted structural integration, favouring other models of collaboration. But one wonders in some ways, do we lose out because we have this structural link between health and social care services, but not with housing services or with other services that for an older person is so important to their quality of life. And I know that one thing I meant to say when I was commenting on what the Law Commission report said about the individual being at the heart of this process was that they were saying that they knew the Dillnot Commission was going to be saying that local government ought to be leading in this, that local government ought to be taking responsibility for health and for well-being more generally. And that's the kind of thing that should be devolved to a local level. We don't have a mechanism really currently for that because our local councils don't do any of that. But whether, way down the line for the future, this is something we need to think about. We look at the size of our trusts. They're very big trusts. They're serving very big populations. Are they perhaps removed, too remote from the populations that they serve? I don't know. I'm not posing any answers. I'm just posing more questions. But, it probably just makes as much sense for social care to be linked to housing, actually, than it does to healthcare in some respects. Chris is saying no. It's good.
Okay, well, I'm going to draw the conversation to a close. And as I said earlier, you're welcome to continue the conversation